Maybe now it seems it's not moving anymore. So welcome everybody. Warm welcome from all of us. This is the webinar for the Master of Science in Epidemiology at Imperial College London. I am Marta Blangiardo. I am the course director. I'm here, and here with me there are Sungano, who is the course organizer and lead teaching fellow, and Nick, who is a guest we have here. He is a former student and now a teaching fellow. So I am gonna give you a flavor of what you're gonna be seeing during the program if you decide to join the program, and then Sungano is gonna go more specifically into how the program is organized. And then Nick at the end has a few slides about his experience. I just want to remind you to use the Q&A for questions, and those are going to be either answered live or in the chat, basically. So can I have the next slide, please? So as a starting point, let me just say that at the core of all this, there is the name epidemiology, which comes from the pressing need of understanding what is good and what is bad for our health. Epidemiologists, scientists are always asked questions about why we get diseases, how we can fight the diseases, how we can get better. And you can remember during the COVID pandemic, which seems really, a long time ago, but it was just 5 years ago, there were scientists on the news all the time being asked questions about why some people get sick and some other people do not get sick, how is lockdown working, is it working, etc. Obviously, this type of questions are very general and transferable to other diseases, like you can think of air pollution. Is air pollution bad for mental health? Is a new vaccine for malaria working? Is specific diet a risk factor for cancer? So in a nutshell, next slide, please. Thank you. In a nutshell, epidemiology studies the distribution and determinants of health-related states or events in specific populations and apply this to the control of health problems. Now, this is very, very general, and you can see this could encompass different types of diseases, non-communicable diseases, but also infectious diseases. It could consider risk factors and determinants of health that could be genetic, it could be social, it could be environmental. And then also it includes a very important component, which is the methodological component. So how can we answer these questions? So we need some methods coming from mathematics, coming from statistics, coming from machine learning to really answer these questions. And all this is basically something you are going to see as part of the program. Next slide, please. So let me go back to the very beginning to what people consider is how epidemiology was born. And it goes back to John Snow, who was a clinical doctor who was living in London in the 1800s. And he's considered the father of epidemiology because in his time, at some point, there was an outbreak of cholera in a specific part of the city. And the theory was that it was due to the air being contaminated somehow, but he was not really buying this. And so he decided to really do an observational study. He went into the field and he started looking where the different cases were located. And you can see those little squares in the map in the middle. And then the big dot is a water pump. And actually realized that all these cases were around this specific water pump, which got water which was sewage contaminated from the River Thames. So really, it was the first epidemiological investigation, and I would always add, is also the first spatial epidemiology investigation because it was really using a map to try and connect cases with some point sources. And this is also something that we covered during the program, as we have a module in spatial epidemiology, basically. Next slide, please. Over the century, the field of epidemiology has become really, really huge. to describe and understand the causes and the risk factor of specific diseases, to also describe how diseases change in time and in space, for instance, in terms of surveillance, to also study how people get sick and why. So if you start with everybody being healthy, then you can see that some people get a specific disease. Some of these sick people get more severe symptoms, some die, some go back in remission. And really, epidemiology is also studying all of that. And also evaluate intervention. So if we put something in place to actually try and curb the burden of specific disease, are we able then in the end to eradicate those? So during the program, you are going to become an expert in methods used to find causes of health outcomes and diseases in population. And here are some of the questions, very broad, that you may be looking at. And you can see some are very general. What diseases kill us and make us unhealthy? How do we know that? Some are very specific, like where did HIV and Zika and SARS-CoV-2 and monkeypox came from? Some are really looking at the why. So why do we see differences across the world or in the same country or sometimes even in the same city, for instance, in the life expectancy? And something is related to how drugs work. So how do we know that a specific medicine that our doctor give us work, and actually do they work? Next slide, please. You will be studying in one of the leading institutions in the world, Imperial College, and the School of Public Health is one of the leading departments for public health research. There are two Medical Research Council funded centers within the School of Public Health. One is in global infections disease analysis, and the other one is in environment and health. And we do all this exciting research, and here are some examples of how our research goes into the news. For instance, we work on air pollution, we work on cancer, on vaccines, on long COVID, on monkeypox, etc. Within the UK, within England, Wales, Scotland, but also globally. So we've been lots of collaborations with African countries, with South American countries, Asians, and so on. Next slide, please. The School of Public Health has a very active engagement with government and with policymakers when they need evidence-based to make evidence-based decisions. So, for instance, within the MRC Center for Environment and Health, we have been advising the chief medical officers on the effect that aircraft noise has on cardiovascular disease, and that was particularly relevant when there were discussions about expanding Heathrow Airport with another runway. Heathrow Airport is one of the busiest and biggest airports in Europe and in the world, but also trying to evaluate policies. So when there was an ultra-low emission zone put in place to try and reduce air pollution, we actually advise about how to evaluate this policy to see if that worked. Next slide, please. And within the MRC Center for Global Infectious Disease Analysis, there was obviously, this center had a key role in advising the government during the COVID pandemic, particularly in terms of the modeling of the COVID infections and also in terms of putting in place non-pharmaceutical intervention. But also, as another example, when there was a monkeypox outbreak almost 4 years ago, a task force was created and several members of the Department of Infectious Disease Epidemiology were in the task force to try and fight the disease. Next slide, please. And then going back to what I was saying before, another aspect that we also focus on is the methodology to answer epidemiological and public health questions. And so we work a lot on machine learning and statistical methods. And you can see here a couple of examples. On the left is a machine learning methods to try and track different variants, SARS-CoV-2 variants during the Omicron pandemic. While on the right, You see a spatiotemporal model looking at how chronic obstructive pulmonary disease due to hospitalization, due to high temperature, so extreme temperature, heat waves, is changing in space across the country. Next slide, please. So you can see, obviously, epidemiology is at the core, but is much more than just the name. Is really a multidisciplinary program where you have the opportunity of looking at different outcomes, outbreaks, communicable, non-communicable diseases, different determinants, environmental, genetic, social, and so on. You can also look at health inequalities. You can also look at public engagement. All this is somehow covered in the program. And then, as Sungano is going to explain later, you'll have the opportunity during your dissertation, which is the key component of the program, to go much more in depth on one specific topic that is your main interest.
I think that is your bit done, Marta. Thank you so much for that fantastic overview. As Marta has introduced earlier, my name is Sungano, and I am a principal teaching fellow in the School of Public Health. I organize the MSc in epidemiology, so I'm the course organizer, and I'm going to give you more detailed information on the structure of this MSc that you're interested in. I'm hoping, because you're interested in it, you have had a view of the course website. So this is a screen grab of that web page, which is embedded in the School of Public Health. So hopefully you've also had some good sight of what else is going on in the School of Public Health, which corresponds with the research that Marta just described. I'm going to give you detail on the course, which is taught by researchers and academics that come from the School of Public Health. And that is important because those are the individuals that are going to be instructing you and also supervising your research projects come end of year. So in the first term, starts around September, October, you're introduced to epidemiology through 4 compulsory modules. I'm going to detail these in a minute. You will then have an introduction to more advanced modules in term 2. Most of them are just 5 weeks, one is 10 weeks, which give you an opportunity to advance your modeling and statistical skills through a combination of those elective modules. There's some that are not so modeling and stats heavy and give you some insight as well into policy and impact assessments. In term 3, you will be working on your individual research project. And this is a project that you can co-produce with supervisors in the School of Public Health, or which will be made available to you by School of Public Health academics. The 4 compulsory modules that you're going to be taking in term 1 are Introduction to Statistical Thinking and Data Analysis, Principles and Methods of Epidemiology, Research Methods, which gives you an introduction to quantitative, qualitative, and mixed methods research, and Introduction to Infectious Disease Modeling. You will also have some non-credit bearing seminars and tutorials. The compulsory modules that you're taking each carry 7.5 ECTS, and ECTS are the European Credit Transfer and Accumulation System. So provides parity and an opportunity to transfer courses into other institutions and countries based on this recognized measure of what a module or a component of the course is weighted at. So in term 1, you will collect 30 ECTS, so 30 credits for the program. And in term 2, you get another 30 credits. And term 3, you collect another 30 credits so that you have a full master's program, which weighs 30 ECTS or 30 credits. And that is the norm across all master's programs in the UK. This is how your modules are structured. I've detailed what modules you'll be taking in term 1. This gives you a representation of where you will be taking those modules and how they will fall in the work week. In the first week of term, you'll have induction. So that whole week, you'll meet the course teams and be introduced to the courses and support systems. And from week 2 onwards, every Monday, you have introduction to statistical thinking and data analysis. And Tuesdays, principles and methods of EPI, and so forth. On Wednesdays, you don't have a credit-bearing module, but you will have an opportunity to develop and practice your R coding skills as well as mathematical skills. We use R on this program, so we get R coding support on Wednesdays, which I will encourage you to attend right now, as well as an induction. We'll reiterate this encouragement because it is really important that you develop strong R coding skills and you're not taught R on the modules. You will practice and apply that, say for Intro to Stats and IDM, but they don't teach you R skills. But we do provide an opportunity for you to develop those R skills through these non-credit bearing sessions. You will also get optional maths, which you will apply to a couple of the modules in term 1 and a lot in term 2. After the 10-week modules in term 1, you will have a period for independent study and preparation for assessments, which will take place in the beginning of term 2. Term 2 has these modules that you can select from, and you can take any of them as you wish, as long as they add up to 30 ECTS, so 30 of those credits I mentioned. There is one that has a prerequisite, which is number 5, the outbreaks module. And for that, for you to take outbreaks, you need to take further infectious disease modeling as a module as well. So it's a prerequisite for outbreaks. Otherwise, you can take any of the other ones in any combination as long as they add up to 30 ECTS. You'll see there that the top module, Bayesian reasoning and methods for spatial temporal data, which is led by Marta, Professor Blangiato, carries 10 ECTS. So if you take that module, you can only take 4 more so that you have 30 ECTS from term 2. And this is how that term is structured. So if you take Bayesian, every Monday you're attending that module. And then any other of the modules that you selected will also fall in precise periods or precise sections of the term. So you have 5 in the beginning of first half of term 2 and another in the second half of term 2. We're trialing this year a study week, a break between the first block and the second block, which is not represented here. So we're going to evaluate this at the end of the year. Seems like it's worked well so far. So it is likely that when you join Imperial, if you're coming here, you will have the first 5 weeks of term for one module, take a break for 1 week, and then continue your other elective modules in the second half of that term. You will have taken all of your exams or assessments from term 1 in the first week when we come back in January. All of your elective modules over those 10 weeks, plus 1 of the for a break, and then once again have an independent study period, which tends to fall over the Easter break or Easter period. Then come back after Easter to complete assessments for all of your term 2 modules. In term 3, after your assessments, you will have a dedicated 4-month period to complete your research project. The research project is core. So I've described what we call the compulsory modules that you take in term 1, elective modules that you take in term 2, and then this one core module on this program that you take in term 3. It carries 30 ECTS and it represents the bulk of intended learning outcomes for this MSc in epidemiology. It is supervised by at least one academic in the School of Public Health. You can have an external supervisor as well. And you have the opportunity to develop your own research project and present it to SPH or to the School of Public Health and the course team. Whatever you develop or whatever idea you have that you bring with you and want to complete as your research project should be something that can be supervised by an academic in the School of Public Health. So as you develop your project idea, you should check what research is conducted in SPH so that you can see if there is anyone in the school that could supervise your project. You don't have to identify a supervisor yourself in the first instance, but should work out if there is a group that could potentially supervise. We will support you in identifying a supervisor for that project. And as mentioned, you can have at least one external supervisor as well. So as long as one of your supervisors is from SPH, you can have externals, as many as you wish. The project is detailed, or you will write up your project in a report that comprises 5,000 to 7,500 words. And you also have an assessed background presentation and an assessed final viva and lay summary of the project. So just going a bit deeper into the research groups, as mentioned, if you happened upon the MSc in Epidemiology web pages, you will likely have navigated there through the School of Public Health home website. That details all the research groups that are in SPH. You may have just Googled MSc in Epidemiology Imperial and not seen all of these research groups. So I'd encourage you to go back onto the Imperial website, look up the School of Public Health, which is where this MSc is housed, and then see all of the research groups that are in the School of Public Health. Because, as mentioned earlier, all of your instructors on the course come from these different research groups, and this is also where your project supervisors will come from. We have these 6 research groups distinct, and the MSc in Epi is housed primarily in infectious disease epidemiology, which is led by Professor Fisher, and epidemiology and biostatistics, which is where Professor Blangiardo sits, led by Professor Paul Elliott. And you can see the different research areas or disease outcomes that they investigate or that they primarily research. Infectious disease epidemiology, as the name suggests, infectious diseases, HIV, malaria, neglected tropical diseases is a strong group within that. You can conduct or complete your research project in any of the other research groups. So we mainly have projects for this program proposed from infectious disease epidemiology, IDE, and epidemiology and biostatistics. Those are the ones in the middle of this slide. But you can also conduct research with the environmental research group, primary care and population health, clinical trials, and the aging unit. There is no hierarchy in that. It is all open to you. The key thing is that whatever you conduct as a project should represent the bulk of intended learning outcomes for the MSc in epidemiology, as it is core. So the take-home message from this particular slide is, please may you go onto the SPH website, review the research that's been conducted, because it speaks quite a lot to the teaching that you will get through the year and the research that's expected of you at the end of the year. So this represents the dissertation journey, which I'd like to encourage you to start thinking of now. So if you have some idea of what's of interest in SPH after reviewing the course website, start thinking on a potential research project that you can conduct, because that guides your progress through the course. In particular, it guides your selection of elective modules in term 2. Everyone will have to take the compulsory modules in term 1, and this is an opportunity for you to then start speaking to potential supervisors and to co-develop a project with them. The dissertation journey formally begins in April, but you will have begun to potentially develop a research question on research methods or independently with potential supervisors as well. In term 2, you take electives that support that project. And then from April onwards, for that 4-month period, you will be completing the project. So begin the background reading. The first assessment, which is the background presentation, this is the first summative assessment for this dissertation, will be normally in early June. And then you will be writing up or conducting the research and writing up all the way through July. And submit your written dissertation, so the 5,000 to 7,000 word report in August, and finally have an oral viva in September. There's a prize for the best project, and we encourage publication. And whatever you do through your research project usually supports your career plans, or we encourage that you consider that as you're making your career plans, so that you can present that to future employers as experience that's relevant to what you want to do. These are examples of summer projects that are being conducted by students or former students on this MSc. And you will hopefully see from there that there's representation from epidemiology and biostats, from infectious disease epidemiology. We've also extracted and included a few here from, say, primary care and population health, environmental research group. Not necessarily any from aging here, but we've had projects from the aging unit and clinical trials. The top section are projects that were proposed or submitted by academics in the School of Public Health, and the top section with the student-led projects are questions that were developed by people that were in the seats that you're occupying right now, came with project ideas or developed them in term one in partnership with instructors on modules and academics. So all of those titles were co-led or student-led projects. We'd hope that by the time you complete the MSc, because there's a heavy focus on quantitative skills, we hope that by the time you come out of the MSc in epidemiology, you have strong quantitative skills that are required for modern epidemiology practice. You will have guidance in designing, constructing a research project through your various, particularly principles in epidemiology and research methods, and then skills in analyzing and interpreting data and presenting findings through your other modules. So you will have a rounded set of skills in quantitative as well as qualitative research methods and overall the core skills that you need to be an expert in epidemiology or public health research. There's a strong focus on the development of critical thinking and skills in all of that, and you'll have proficiency in data analysis, particularly in R. Most of our students go on to careers in research, and the bulk start off those careers in PhDs. So currently, we've got a lot of students that were applying for PhDs. Most of those deadlines were in December, January, but several are also still applying for the later deadlines because there's no one timeline to apply for PhDs. So I know from the current cohort that most want to go to PhDs, but that's not the only endpoint. Quite a lot have gone on to careers in local government. They're still quite connected with us and encourage you to have sight of the sort of roles that they're in. We have introductory or entry-level roles in healthcare and industry, in pharmaceuticals, as analysts in most cases, and as epidemiologists in different settings. So drilling down into expectations for you at this point, the MSc in Epi is highly competitive, and we normally get 200 to 300 applications per year. We've already surpassed the 200 point in terms of the applications received for only 25 to 30 places that we have available per year. Sorry, there's a point here that I needed to update. We filled more places than when applications were open earlier. Applications are reviewed for within 4 to 6 weeks, and we tend to close applications in May, June, and that is likely going to be the case this year. You need to have a degree in maths, stats, medicine, or biological science at least a 2.21 level, so an upper second class degree or a first. And you should demonstrate quantitative skills. So you don't necessarily have to have one of those skills, those degrees listed above, but should have some demonstration of development of quantitative skills with good grades in your undergraduate or through other research activities that you can demonstrate in your CV and speak of in your personal statement. Going into the personal statements, this needs to be quite persuasive and speak directly to this MSc. Why do you want to complete the MSc in epidemiology? How can we support you in completion of this MSc? We have seen since the development of AI, a lot of use of AI in writing up personal statements and CVs in a way that does not give us sight of who you are and why you're interested in the program, which is really problematic because we want to be sure that we can support you in your goals and that you're well suited to the demands of the MSc in epidemiology. So we'd strongly discourage the use of AI in writing up your personal statement. Write it yourself and identify elements of the MSc that are of interest to you, particularly speaking to all of what I've outlined about the course, why you want to complete the program, areas of research that are of interest, how they speak to your experience as well as your future plans. Detailed CV that speaks to your suitability for this program as well. And English language skills are required at the higher level. As an example, IELTS 7 or above. And we also look at letters of support from your undergraduate, at least one academic letter of support, and another can be from your previous employer. you may be invited to an interview, particularly if we're not certain or if we can't quite flesh out what we need to assess from the documents that you've provided. So usually the interviews are quite informal and we just be asking you to speak to what I've just described. Why do you want to take this MSc? What is of interest? What can we do to support you with your future plans? Just to assess your understanding of the program, its demands, and what you will get once you get to the program, and for us also to assess your suitability for it. There are usually a lot of questions about funding. So I've collated this with deadlines, which is a representation of the scholarships that are available at Imperial as listed on the Imperial scholarships page. You may know of other scholarships that are available externally, so through your country, government, or other independent organizations, but these are the ones that are listed on the Imperial scholarship pages. So I've extracted those, but you can also go to the Imperial scholarships page through that link below the QR code and type in public health and this all the scholarships that apply to the Faculty of Medicine, particularly this program, will come up. There is a fantastic new scholarships, a very generous scholarship, sorry, that's been made available to us. And this is the top one. She's the Lord Robert May Scholarship. You might already have come across it. And this year it covers full tuition for an overseas student, plus a really generous stipend, about 20,000 for living expenses. So the full tuition would be paid plus the stipend. And this closes on the 30th of April. There are other scholarships that have already closed that you'd be aware of, such as the Commonwealth and Chevening apply to specific countries. Those have already closed, so hopefully you've already applied for that. And you have the Sanctuary Scholarship, which also covers full tuition. So these are the ones that cover full tuition, which apply to most applicants. Then there's select ones, say the BSESU, that is specific regions or specific countries as listed. There are other scholarships that only cover home tuition, so Student of Black Heritage, and we have the School of Public Health scholarships, Dean scholarships, as well as scholarships supporting disabled students. The partial scholarships is available listed there. This year, the Great Scholarship is open to applicants from France, Egypt, Ghana, and Nigeria. So please do have a look at all of this. The slides are going to be circulated to you. Look at the deadlines and see if you would like to apply or if you need to apply to any of these, and make sure you catch those deadlines. So I am going to hand over at this point to Nick, who was introduced earlier by Marta, and we thought you would want to hear a little bit from Nick based on his experience from the MSc. So I won't go into any detail on this, and hopefully Nick will tell you a little bit more about himself as he talks over this slide. So over to you, Nick.
Brilliant. Thanks so much, Sunano. And thank you, Martha, for the introduction. Hi, everyone. My name is Nick, and I'm currently a teaching fellow at the School of Public Health. I mainly teach on stats. So if you do join us in September, I'll be supporting you on the Introduction to Stats module. So this is just an overview of my experience of the MSc in Epidemiology. So I was in the 2019 to 2020 cohort. The so-called sort of like COVID cohort. My studies actually were sort of within the pandemic actually, but I will come to that one. But just to start off, going back to some of the things that Sunana was mentioning about the application process, I actually applied quite late actually. I believe maybe June or July, so just before it actually closed. So I was quite lucky, and I do feel privileged that I was accepted on the course because it's a fantastic course, and I think it gives you an overview of and makes you at the end of the course, it makes you a really good sort of prepares you for a good epidemiology career. To start off, in August 2019, I think even before I actually applied, I was looking at the course requirements, and I was picking out the things that are my strengths and some places where I could actually improve on. And one of it was actually R programming. So obviously, as Sugano was mentioning, this is quite a quant-heavy program. So R programming is something that does come up quite often in different modules, both term 1 and term 2, and also in your dissertations, actually. So that was something that I wasn't really confident on. So I went on and did a couple of courses, online courses on R just to get myself prepared for the program. So in a similar way, if you do feel that there's something that you want to prepare yourself for, there is a next slide on summer readings, but I would recommend you to actually have a look at the core modules and also the elective modules as well, and see which ones you'd want to focus on. So, for example, you could focus on introduction to stats or R programming, like myself, or if you're not too keen on infectious disease modeling, have a look at the infectious disease modeling readings as well. So between September to December, there were the core modules that Sungano was mentioning earlier. To give you a sort of an experience, the course is quite busy. So it's quite um, the experience is great, but be prepared to sort of like be busy for the whole year in a way. So September to December just plunges you into sort of like all of the core modules, especially epidemiology and introduction to stats. So that's why I put the medical statistics book over here, actually, because that's something that we heavily sort of rely on for the module. And it's a really great book that actually helped me as well throughout my program in there. And then between January to May, so just before that, actually, between January to May, we had the term two modules. And as Sunanu showed earlier, there was a range of modules that you can actually select from. So do have a look at some things that are interesting to you, read on it. If there's something that you're not familiar with, do read on it and see whether, that would be of interest for you. So, for example, for me, what I did was there was a module on genetics of infectious disease pathogens. And there were things on phylogenetic trees and all of that that I'm actually quite interested in. And it stemmed in from the spatial epidemiology module as well, actually. And in my time, the Bayesian and the spatial epidemiology was actually two separate modules, but I'm quite glad they actually have it together now because it's quite it relies on each other and it's quite a good module, actually. Not promoting any specific modules over here, but do have a look at all of the modules that you've done, because the modules that I took was quite a range, actually. So I went from neglected tropical diseases to molecular and genetic epi, and then genetics of infectious disease pathogens. So between January and May, I had a really good experience with all of these different modules. But obviously in March, COVID struck. So we did go online, but the kind of support that you got from everyone on the course was actually fantastic. We had our own sort of computers to work through with the computational aspect of the program, but also support from the support team on doing exams online. So obviously that's something you wouldn't actually have to go through during your course, but the level of support that you actually get from all the course team is just fantastic, actually. So that's something that I would like to actually highlight as my experience. And then the dissertation phase started sort of in March in a way, because we got a list of our projects. So as Sunano showed you, there's a list of projects that the team actually put forward. But obviously there were a few who did their own projects, actually. So I actually selected a project that was advertised. And I think, again, the whole process was really, it was a fantastic experience in a way. Because I was able to actually, so for my dissertation, to give you an overview, what I did was I did a systematic review, but also I did a secondary data analysis as well. The supervisors that I got were fantastic. So actually, I didn't know the supervisors, to be honest. I only went for the project because of the outcomes of the project. It was mainly a systematic review that I wanted to actually do because I didn't have experience in that. And also I wanted to do a secondary data analysis as well. It was specifically on a particular type of regression analysis that you'll learn in the stats module. But not having known the supervisors was not an issue, because the supervisors were actually very supportive throughout the process and beyond, actually. So, when I submitted my dissertation in August, I was initially hesitant on how to approach them for a publication because that's something that I wanted to actually do. And I remember actually speaking to Sungano about this, and she gave fantastic advice and support on how to approach my supervisors actually. And that was a fantastic opportunity because I think this was my first ever publication, and since then it sort of helped me on my career ladder. And I think the support again that you get from the supervisors, but also the team is just overall fantastic. So I think overall my experience from the MSc in Epi was great. And I've just put a map over there, disease mortality map over there, just to highlight that one of my favorite modules was actually the spatial epidemiology module. So if you're interested into maps, that's something that you can actually go. But beyond that, there's just so many different research groups that you can actually contact, and you've got the exposure, I would say. And the MSc actually, just to add to my last point, the MSc in EPI is actually quite around 30 students. It's quite a nice sort of community that you've got. But it's not only the smaller community within the EPI, but you have the opportunity to speak to your colleagues from the other master's programs as well. So the wider sort of SPH community is great as well. So yeah, thank you very much for that, Sanana.
Thank you very much, Nick. So I see you added the Kirkwood Medical Statistics text, which is what you use for introduction to statistical thinking and data analysis. And maybe going on to the final slide that I have here, I will point to the link that's right at the top of this page. So this GitHub link, the Imperial one. We update it yearly for offer holders. So if you're coming to Imperial, we give you some idea of the preparation that you could do to support your skills going into the MSc in epidemiology. It's open and available right now, but needs updating with dates and information that applies to the 2026-27 academic year. The reason I mention it here is that it also identifies the key texts, such as the textbook that Nick's mentioned and included in his slides. So we just highlight some of the instructions or guidance that's been given by module teams, such as the ISTDA module team that Nick is with, who recommend that Kirkwood textbook. We also give guidance on how to start preparing for your project, what the year will look like on this GitHub page, so not on the SPH website. There's also other information that would support your preparation for R or use of R. And maybe jumping ahead of myself, I saw there was a question in the Q&A about why we use R versus Python. And it's more suited to statistical analysis for our research areas. And it's the preferred for all of our research groups now. We used to use R and Stata in the School of Public Health. But when we went online in 2020, all of the research groups that were using Stata migrated to R. So there's still some researchers that use Stata, but mostly use R, and all instruction is on R. And you will find that more of those that use machine learning use Python. So you might complete your research project on Python. You could also use Stata for your research project. There's nothing to stop you from that, but the instruction that you get on the course will be on R. Some reading that will be relevant or interesting to you that applies to the sort of work that you'd be doing, and things such as the Fair Society, Healthy Lives, Risky Talk. We had a recent talk by Professor David Spiegelhalter. Bad Science just talks through what good and bad practices in public health research look like, and a series of other readings that you might find of interest that speak to the course that you're going to go into. But I'm conscious of time now, so we'll stop here, and we'll hand over back to you, Marta, in case you have any last points or to lead the Q&A. But ahead of that, very quickly, if you have any questions, please email MSc in Epidemiology on that web address. So over to you, Marta.
Thank you, Sungano. Thank you, Nick. Yes, no, I don't really have any final points. Maybe just stressing once more what Sungano was saying about when you write an application, if you decide to write an application, be really, just write the personal statement in a way that make us understand who you are and why you have a passion for epidemiology and why do you want to join the program. So I think we can go into the questions. There are three. Well, maybe one we could, I mean, the one on our, I would say Sungano has already kind of answered that. So really, it's just more suited for the type of research, the type of analysis that we are gonna carry on during the program. So that's why we use R. So there is one which is on asking when does the next cycle of admission begins. Well, it's actually open. It's something that it doesn't really close until actually when we're full, basically, and that's what Sungano was saying before. Usually is about 4-6 weeks. So whenever you want to apply, you apply, and then in about 6 weeks max, you should get an answer. Other part of the question is it's hard to tell basically what type of background. So the background, saying that you have a degree in veterinary science is, I don't know. It's really hard to say, if your skills, quantitative skills, are strong enough or not. Obviously, I don't know the specific. I would say I think we had, Sungano, okay, you can correct me. I think we had some applications before. Certainly, we have applications from a very, very wide range of backgrounds, from people with very, very wide range of background. And if you can prove that, obviously, looking at the grades, that's one thing we do. We look at the grades during your BSc and see what type of modules you have followed, so what type of experience you may have. And then obviously you should sort of like stress in your personal statement why you think you have the skills. I would say that the maths and stats modules are quite advanced. I mean, we covered the basic, but the pace is quite sort of like fast. Maybe Nick, I don't know if you want to comment on maybe the intro to stats specifically, but I would say that's generally the case.
Mhm. Yeah, no, that's right. Thanks, Martha. Yeah, that's generally the case. And the intro to stats is quite fast-paced. But the sort of level of support and resources that you get within the module is quite is quite good as well. There's a good sense of community between the students as well. That they help each other, but also as Sunana was mentioning about the optional R coding sessions on Wednesdays, I believe it was. That is fantastic as well. So if you're not if your skills are not too polished, say in R, you've got the support within the program actually. So that wouldn't really be an issue.
Thank you, Nick.
And I would add, if they've taken a module in Introduction to Statistics or something that shows us that they have done this in their undergraduate and would be able to keep up because they have an Intro to Stats module. And quite a lot of the medical degrees and vet science degrees do include a research component. So an introduction to stats as well as some sort of research module. So hopefully your transcript would also show us at what level you're performing at in your undergraduate.
Wonderful. Thank you, Sungana. Thank you, Nick. There is another question on what would be the best time to reach out to potential supervisors. Can we start reaching out while we're waiting for admission? Sungana, do you want to say something about this?
Yes, I can certainly say that. So it doesn't make sense to contact supervisors before you confirm that you're coming to Imperial. So it would be a waste of your time and theirs to work on a project that you may not complete with them. So we'd ask that you do not contact potential supervisors yet. Once you have an offer, start thinking about it. But because you won't have an Imperial email, anything sent to potential supervisors will be coming from an external source like Google, Yahoo, and may not get the sort of attention that you would as an Imperial student. We guide you once you're here with who you may contact and potentially can introduce you to them. So the best time to reach out to potential supervisors is once you get to Imperial. It can be in your first week, can potentially even be on the first day, but at least once you get to Imperial, say hi to us, potentially ask me if this person is worth contacting or if they're a suitable person to potentially supervise your project. Then we start those conversations going. Quite a few students got in touch with potential supervisors in the first couple of weeks. because you still have that momentum and interest, and they're also quite eager to have connections and interactions with you. Some have only just made those connections in the last few weeks because students are selecting their projects now. So some students have had a look at the project list, then decided that they want to work on something and some idea that they had from earlier on. So it takes more time to potentially develop their proposal and question, but it still can be supported even up to this period, such as February, March, going into 2027. As long as everything is in place by April, the project period, then you're fine. But please only contact potential supervisors once you're at Imperial physically.
Thank you, Sungano. There's another question which asked, are we able to collaborate, contribute with research groups of our interest field during the duration of the program? And I just want to stress what Sungano was already saying. This is really what you're going to do during the term 3, basically, during your core module, which is the dissertation. And I would say before it's really hard because obviously the MSc, the teaching component is really quite fast-paced again, and there is a lot to do. So obviously you're going to focus on learning all, sort of like all the things that you have to learn in order to be able to do your dissertation. But during the dissertation, and re-stressing what Sungano just said, you can start making connection as soon as you arrive, but then really doing the work together is probably going to start after you finish all the taught component of the master, which is basically after Easter. Yeah. Yes, anybody else wants to add something on this?
No. So I wasn't certain of exactly what they mean by collaborating with research groups. And I wonder if that was the same question about the co-supervision, so collaboration on development of a project with a research group in the School of Public Health, in which case, by all means, that is what we encourage, that you collaborate, you start building your network and collaborating within SPH, potentially get your supervisor from here. If there are research groups that are outside of the School of Public Health, then yes, you can have a collaborative project with, say, someone who's based in brain sciences, because we have some synergy there, say brain sciences, surgery and cancer. So potentially researchers that are in the Faculty of Medicine, but not in the School of Public Health, could be collaborators, but you need at least one supervisor that is based in the School of Public Health. So if, for instance, you wanted to do a research project that is not supervised by SPH on cancer outcomes, and we've got the Department of Surgery and Cancer, at least one person should be from SPH, and then you'd have the other co-supervisor in surgery and cancer in the Faculty of Medicine at Imperial. You'll have a better understanding of the hierarchy and structures of departments once you're here, but just keep in mind that at least one of your supervisors should be based in the School of Public Health. External collaborations, for instance, some that have occurred in the past with researchers at, say, the London School of Hygiene and Tropical Medicine, or other institutions such as, so we've got research partners across Europe, and in some cases in institutions such as UC Berkeley. You can have supervisors there and collaborations with those research groups, but must have at least one SPH academic that supervises. We have people that have 1 foot in SPH and 1 foot in, say, UC Berkeley, as mentioned, but they're based on paper in UC Berkeley or in the London School of Hygiene. So you need to find one of their collaborators that's in SPH. Usually they already have ongoing partnerships. Marta, you've co-supervised projects, I think, was that with
France?
External.
Exactly. Okay, so there is another question which asks if people with a mathematical background are at an advantage compared to someone who has a biomedical science background. And I would say, not necessarily. It's as hopefully what came out from our slides is this is really a multidisciplinary program. So quantitative obviously is important because we are using the methodology, the approaches to actually answer the question, but it's not the only thing. Okay, so we have had plenty, we give you plenty of examples of people who went with mathematical background did very well and who didn't do very well. So honestly, it really, really depends. Depends how motivated you are, how keen you are on learning, and maybe someone who doesn't have a mathematical background needs a little bit more kind of like work to start with to get to the same level as everybody else, for instance, on the coding or, on the probability side or whatever. But then, maybe I'm sure they have other skills which someone from a pure mathematical background doesn't have. So absolutely not. The next related question is, how does one stand out in competition? I only have a very little coding experience. Again, I would just say, if you're really keen, if someone is really keen and realize, as Nick was saying before, if you realize you have a gap in your knowledge that you think and that you have seen from this webinar, from looking at what is on the MSc website, etc., that is going to be key, you can spend some time trying to learn that, and that is really what help you stand out in competition, I would say, because at least it shows that you're very, very keen. Yes, I don't know if Sungano or Nick wants to add something.
I suppose I can add that if you're doing a program that doesn't give us a chance, or that doesn't show us what quantitative skills you have, then it's useful to supplement that with, say, a standalone short course. The self-taught, you could potentially describe what you have done in your personal statement in some work that you have then applied these self-taught skills. It's more meaningful and potentially useful if those self-taught skills have resulted, let's say, in a publication that we can look at, or in a certificate that has a grade on it from an external partner. So you don't have to have the module in your undergraduate, but let's say you've done a short course that's then graded. We see that there's a grade to it, or worked with a research group and there's a paper that's been published, even though your skills are self-taught. It's potentially not quite enough to just say, I have engaged with this, but it's better to then expand on what you have done then in a way that demonstrates that you have understood what you engaged with. So there's no one right answer for how you demonstrate this to us. And in some instances where it's not very clear, we then have a conversation with you at the interview to say, okay, so what exactly did you do? What course, and how do you see, what skills have you developed, so you can tell us a little bit more about what you've engaged with, and in that conversation you demonstrate understanding of what you were learning. It's more clear cut if you have a transcript that has a stats or quantitative module. I think Nick, you were going to say something as well.
Yeah, no, I was just going to add to that actually, Sunana, to what you and Martha were saying just now. As my experience actually, before I applied to do the MSc in Epi, my stats and well, I didn't have any Epi background, but my stats sort of modules were from my undergrad, which I'd done a few years before. So there wasn't much in terms of relevant experience, if I could say. So I actually supplemented that by doing a course on statistics and epidemiology, just so that I could actually get some footing in a way. And also to add that I did one of the online courses on in R programming, and yeah, so basically that really supports the application in a way.
Thank you very much. I think we are at the end of the time allocated. So yes, I would like to thank everybody for participating, for listening to us, obviously Sungano and Nick for presenting, and hopefully this has been useful. And I think we will, well, we hope to see many applications. And yes, I don't know, Sungano or Nick, if you want to say something else.
No. So I was just going to say thank you to everyone for their attention as well. And I see that there was a one last minute question about the percentage offer, which helps me remind everyone that slides will be circulated. And you will see in the slides, and from my earlier mention, that we get 200 to 300 applications, and that's for 25, 30 places. So I'll let you calculate the percentage from that. AI growing in the industry. You want to know how the university is preparing for an AI-driven world. That's a long question where then we have that's potentially something that I don't know, Mata, if you want to address that, but that there is a long conversation to be had about this. And you will get more insights once you're here, but we are actively engaged and prepared for the demands or challenges that AI is presenting on each occasion in various ways. But I don't know if there's a short answer to this. Eh?
I don't think there is a short answer. I think it's also very, quickly evolving. I think we are very aware of this. That's maybe the short answer. We're very aware of this. We are working as a college and as a program to try and find, the best way of making sure that people who come out of the program are actually going to be performing well in an AI-driven world. But then this is, a longer conversation, I would say, than kind of like 10 seconds.
No, I just wanted to say thank you, Sangana, and thank you, Martha, and thank you for everyone for joining. So, yeah, I just wanted to say good luck for the application.
All right.
Thank you.
Good luck,
Good luck.
guys.
Great. Thank you all.
Take care. Bye.